As a AI engineer, this is pretty special for us to have access to Ivan, who knows more about this than anybody I've come across. Very excited about this. Ivan has a presentation that he's going to do, and we tested it earlier this week. It was 14 minutes, so it's going to be about the first 15 minutes. The last 15 minutes, the last 45 minutes, very intentionally is going to be an open discussion where you've got access to your own AI engineer here. All right. Well, Ivan, take it away.
Okay, so thank you all for joining today. I wanted to talk today about how AI can help healthcare organizations to improve patient care and cut costs and increase revenue, unlock revenue. Um, I want to share a couple of successful cases of how AI helps healthcare organizations. And then I want to show what can go wrong and why. And I came up with a six-step framework that helps to identify AI opportunities and implement those in your company. So I would like to share that. And after that, I would like to open the discussion so that you can share maybe your stories about implementing AI, using AI, or maybe you have some ideas you want to discuss with the group. Um, did you know that 80% of healthcare data is unstructured? So, what does it mean, unstructured data? It is information that stores in its original format, which is not organized in tables, rows, columns. So you can think about clinical notes, doctor dictations, lab reports, or discharge summaries. Um, what does it mean? It means that this information is stored in the raw format and is not organized to be analyzed or to get insights from this information. And with the development of AI, and specifically with the development of large language models, these models have capabilities to read the texts and extract the insights and extract some specific information. And these insights can be used to improve care and cut costs. So now I want to show a couple of examples of how companies actually implemented that. So Fisher Titus Medical Center, based in Ohio, is a 99 bed hospital with about 120 physicians. They had kind of usual problem that physicians spend a lot of time on documentation instead of patient care. And they introduced two solutions from Microsoft. One solution helped doctors to dictate their notes, and the second solution transcribed those dictations and popped this information in HR. And that helped them to reduce to save from 1 to 2 hours per day per physician. It also helped to prevent two physicians from quitting. That saved them 500,000. Also, because of this technology, it was easier for them to onboard new physicians. They improved patient provider experience and enhanced quality of documentation. So another example is South Shore Health, a healthcare provider in Massachusetts with 400 beds and 7 CDI specialists. And that was a lot of volume for this for this 7 CDI specialists. And also organization wanted to increase their comorbidities capture, specifically on sepsis and pneumonia. And they introduced an AI solution that scans clinical notes and flags any any difference between the actual care provided and the documentation. So, for example, if AI sees an evidence of sepsis, but documentation reflects something else, then this case is flagged for CDI specialist, and he can forward that to a physician, and physician can adjust the documentation. So with this technology, they were able to generate 600K per month, triple their monthly revenue, and have 76% reduction in sepsis denials. So this is all sound good, but you may ask, okay, but what can go wrong? And actually a lot. So as by research of S&P Global Market Intelligence, 46% of AI projects never reach production. And there are a couple of things. The reason behind it, that companies focus on nice to have versus business critical operations. Also, companies do not invest needed time into the preparation of their workforce, and that leads that the staff is unwilling to adopt new tools. Also, AI output concerns. So as we all use ChatGPT and other LLM models, we kind of expect that it can have some hallucinations, or it can give some wrong information. But research shows that when these AI tools work in enterprise setup, employees expect that these systems have learning capabilities and memory, which is not always the case, and that kind of leads to frustration. And also, a big obstacle is a lack of adaptation to existing workflows. So either those solutions are not adapted enough, or companies are not willing to adjust their existing workflows to the new requirements that go with the new AI platforms implementation. So successful companies choose projects based on a holistic view of compliance, risk, data quality, and expected business impact. So it's not only about technology, it's about right strategy behind it that includes all the aspects that can lead to the desired business impact. So we came up with a 6-step AI implementation framework, which I want to share. So the first the first stage is to spot opportunities. So you can list all the processes that you think eat the most of your staff's time. Where do you see repeated manual work, or maybe what are the processes that you think, if that would be automated, that can bring additional revenue? Then you prioritize those opportunities by impact. So in general, how much time can it save if you automate it, or how much revenue it can bring? And the next step is you define success metrics. So you define specific numbers, like how many hours can you save? What is the level of revenue you can reach? And also, as these systems are should be and will be embedded in the like whole organization, you need to think about like which roles and workflows will be changed because of this implementation, and also what training is needed. And and maybe you see that like you need to set up some change management policies on how people should adapt those tools. The next one is you build your ROI model. So on this point, you may reach to vendors, You can consider of the shelf solutions, which, by the way, show better results than when companies build the solutions themselves. Or you can, if you have some unique workflows, or you want to build some kind of strategic advantage in the market, you can consider custom development. So you go to the vendors, you may consider several, and you get the quotes on implementing the automation you want. And then you consider three factors to calculate your ROI. So that's how much do you spend right now on these manual operations, then what would be this cost of the solution plus training, and what is the potential savings or additional revenue you can get from this. And then, as you identified this case and you like the numbers, then you start the pilot. So you need to identify the minimum scope that is needed to provide the business value. So you identify proof of concept scope. You can discuss it with your vendors to basically have only essential things for the pilot. Then you onboard and train users. So you do it before this proof of concept launched, because you want them to involve them on early stage, so that they can give feedback on the solution, and maybe even they can help you to design the solution. Then you test it in a limited environment, so you can roll it out to 1-2 physicians, maybe like one small department, just again to see the business value from this automation. And you measure the results. So you measure the business goals, like business targets, or why you're doing this automation, whether there is time saved or additional
This is
revenue.
this is
Sorry?
special time.
Is that you really want to tune into?
I'm going to mute Dr. Ming's phone here.
What's he
Yeah.
saying?
Thank you. Yeah, so you measure the results, and also it's important to involve users who are using the system for feedback. So you track, so you track not only the business parameters, but also the feedback, how convenient the system is, what should be improved, and so on. And if pilot succeeds, you expand. So you plan what you need, how you need to roll the system out. So it's a kind of, let's say, industry threshold that's like you need to target 90 days from pilot to full implementation. But of course, that's only in the case when you have the solution ready. If you build it yourself, then like it's a different story. As you scale, you implement training procedures, you track KPIs continuously, and you measure staff satisfaction of using the solution. So that's what I wanted to share on the presentation part. Now I want to open the discussion and ask you about your data and AI story. Maybe you can share some projects you implemented or you saw were implemented, what worked, what didn't work, or maybe you have some ideas you want to share, or maybe challenges you want to solve and you think that AI can help here.